So I'm Dr. Freddie Caldera. I'm one of the faculty members at University of Wisconsin. I'm assistant professor in the Division of Gastroenterology. And my main clinical and research interest is in inflammatory bowel disease patients. So the reason I really enjoy that is inflammatory bowel disease patients are, a unique patient population, and that's kind of what involved part of my project. So what I did is we looked at the care that inflammatory bowel disease patients are getting at University of Wisconsin compared to rheumatoid arthritis patients, because we're learning more and more, especially with changing healthcare, that these patients can be predisposed to infections, that at times they need certain preventative healthcare measures. And so what we did here is we looked at a special population that get their primary care at UW and also their specialty care at UW. And we looked at certain measures that have been approved as standard of care, such as influenza vaccination, getting pneumonia vaccination, getting screened for your bone health to make sure that's okay. And what we found was that the rheumatoid arthritis population actually was getting some of these healthcare at better rates than some of our inflammatory bowel disease patients. And we found that at times it's even dependent on the specialist. So as GI doctors, we actually have room for improvement in providing care for these patients, and that actually is leading to a future project that we're going to be developing at UW, is creating a registry of these patients so that we can identify them and make sure we're doing everything we can for these patients to prevent these potential complications. So we're going to develop a registry where we keep track of all of them, and we're going to create protocols that are team-based with a provider and nurses so that all these things get done.